If you enjoy this content, please take a moment to rate and review it. Your feedback will greatly impact our ability to reach more people. Thank you.
All right. We are back, and apologies for missing last week. That's all on me. I was supposed to record on Wednesday night, and kind of two things came up. The first was I had, sort of a family health thing that I needed to sort of focus on and prioritize. But the second thing was that I was just realizing the bill wasn't passed yet. You know what I mean? And I was like, I don't want to record a show before the bill gets passed. And then it got passed on Thursday.
Right. Like I think middle of the night or something. Yeah.
Whatever.
No, he signed it Friday. Thursday was the 3rd. Is that right?
Yeah.
Yeah, passed on the 3rd, right?
It passed on the 3rd during the day.
Right. Yeah.
I remember because I was watching TV when it happened. And so, and it happened right before I had to go pick up my girl from the airport. And so I was just like, well, I guess we're not going to have a show. Yeah. So apologies to anybody. But at the same time, the truth is that it needed some time for the analysis to kind of roll out.
Yeah.
Huge bill. There was all sorts of emotions about it for very good reason. It's a pretty hard bill to make sense of. Like if you're trying to sort of figure out what the through line is, it feels like the only through line is more money for the rich people and let's spend all the money on ICE. We're going to dig more into it here in a little bit, but I mean, you can't say it's a deficit cutting bill.
Right.
It's not.
I mean, I think it is Trump delivering on some decent number of his campaign promises, and that's what it is. It doesn't reduce the deficit. It's going to be bad for the healthcare industry in every front.
Well, I guess the point is that if you're going to do something so incredibly impactful to the healthcare industry and to the recipients of Medicaid, right? If you're going to do something like this drastic, you would hope that the clear goal and the clear through line here was that you were also going to cut the deficit. Because at least you could sort of make the call that, hey, we have to get the deficit under control. The number, we spend so much money on healthcare, and this is an awful, horrible thing to do.
Right.
And in fact, that was not the posture. I mean, Vice President Vance was basically saying the Medicaid stuff is a rounding error. The most important thing here is ICE. Right? It was so. I think on Thursday I was not in a good place to even talk about this, quite frankly, because it just felt that it the way it was being positioned was just kind of peak cruelty, as far as I was concerned. So I'm glad I have a week to sort of let it pass, let the analysis kind of come out before we actually talk about it,
Yeah, I think that's fair. I mean, there's a lot to dig through. I'm still not sure we have all of the details, but we have a lot. We have a lot of them.
No, they're emerging, and and we'll point out a couple of things we found out. Like I found out yesterday, I was like, holy cow, this is crazy. Anyway, on a bright note, Nashville Soccer Club is the best soccer team in America right now. I mean,
it's kind of fun to be a Nashville SC fan right
now. Yeah, man. Yeah, I mean, we're in the semifinals of the Open Cup after just a spectacular comeback win at home last night against DC United. They had us down 2-0. We ended up finishing the game 5-2 with 3 SportsCenter highlight goals to wrap up the game, which is crazy. So that is a lot of fun right now. It is a lot of fun to be a Nashville SC fan. So for any of the listeners who are also Nashville SC fans, I hope you're enjoying this because these kind of moments don't happen all the time. It's really, really fun.
This
really,
whole
really
season
fun.
looks pretty good, though.
Yeah. I mean, we're past the halfway point now. We're through the international break, came back, and I think probably more impressive than we were in the first half. So even stronger after the break. So it's pretty great, man. Pretty great. Anything else before we?
No, I don't think so.
All right.
Let's dig into it.
Let's dig in. All right, first thing we're going to start with is the economy, as always. And, we are in a K-shaped economy, right? And so we're simultaneously going to talk about some incredibly hard things that are going to happen for the least of us socioeconomically, but at least our stocks are up, right? 10.1% increase in stocks in the second quarter.
Yeah, so the I forget what he calls them, but Trump's tariff plan was released basically on April 1st. I think it was April 2nd. So the entire second quarter was confused by Trump, then tariffs, then no tariffs, then delay. We'll have a story about that later. But overall, the stock market's up 10% in a quarter, which is incredibly good.
It's ridiculous. It's so I mean, but again, I feel like now, especially after this bill, right? It's even more important that we talk about the K-shaped economy and just how
the stock market is not the overall economy.
No,
right.
not even close.
A lot of Americans don't own stocks.
Not even close. Like when we talk about stocks, we're talking about the asset holders.
Yeah,
and that's those of us who are doing well.
Yeah.
Right? Those of us who are doing well. Even crazier, and I did not know this until you brought this article up. This is Wall Street Journal. Meme stocks and YOLO bets are back and fueling the market's rally. So we haven't really seen this since COVID times.
Yeah.
But we're back to investing in unproductive companies. So there's a whole bunch of companies out there that are unprofitable. In this article, they say, forget the Magnificent Seven. Investors are now learning to love the unprofitable 858.
Yeah.
But these money-losing companies and these meme stocks are starting to draw a lot of investment again, sort of at the highest clips that they have since 2021.
Yeah, and I think this is a symptom of the K-shaped economy. Like if you are the American dream of working hard and getting ahead is not very realistic now. And so I think people are basically gambling of can they get some kind of inside track from a Reddit, forum or something, and then make a bunch of money trading Ava Technologies. I don't know what that is, but it's up 300% in the last 2 months.
Yeah.
And that's fine as long as your stock tips work, but then it's going to crash again.
Sure.
So I understand why people do it, but I fear it won't end well.
Yeah. Same.
For exactly the people that, are not going to be able to sort of roll with a loss like that.
Yeah. Well, I mean, you're not doing it for fundamentals. You're doing it for speculation and momentum. And because other people are in, somebody's going to be holding the bag.
Right. Exactly.
Somebody loses here, right?
Yes.
When there's nothing underneath it.
Yeah.
So, that's
when the music stops, it's hard to know, but there's going to be people that don't have enough money to be gambling like this that lose money.
Yes, exactly. Jobs came in, and 147,000 jobs were added to the economy in June. Basically flat month over month job additions. So, I mean, good-ish.
Yeah, it's fine. I mean, it was positive, which is, good-ish. I mean, the unemployment rate went down.
From 4.2 to 4.1%.
But the reason is that people stopped looking for jobs that were in the labor force, and now they didn't get a job. They just are not in the labor force anymore. So that's not really a good reason for it to go down.
Right.
But it went down. So I don't know. Yeah, it's okay.
Trump delayed reciprocal tariffs after Bessent wanted more time on deals. So this kind of resurged after last week was all about the bill.
Yeah.
And this week has been all about tariffs. So we're back talking about tariffs, and he kind of rolled out a new slate of tariffs this week. Japan got a letter.
Yeah, right.
All the way to Myanmar.
Right,
sort of at
right.
I think it was at the 40%.
The original pause was going to end maybe on July 10th or July 15th or something. So Trump delayed until August 1st and sent up several letters to countries. I'm hopeful that they get negotiated deals done. There's a lot of work to do even between now and August. But
I mean, no rest, right? Like right off of the bills.
Oh, yeah,
not even like a week. Like
right
back into this. You know, so just I mean, there's one thing you can say about this guy. He puts new things on the table at a ridiculous. It's not the speed, it's the relentlessness of them. I mean, every week it's another really, really, really big thing. And I think that the markets at this point have sort of realized that's what it is. And you're just going to have to do business in that environment. And so, you know, you think about the fact that the markets went up 10% over the course of the second quarter. We were dealing with all that volatility, right? You know, it was certainly after, you know, the big shock that came in the first 30, 45 days, right? You know, but still, I mean, a lot of volatility throughout the second quarter, and the market found a way to persevere. You know?
That's right.
Carta came out with their first quarter state of the market. Always a great way to sort of understand what's happening in the VC industry because of their significant percentage of funds that they manage. It's certainly statistically, you know, relevant. The highlights from this quarter, you know, still hard to find DPI. 37% of funds in 2019. And 30% of funds in 2020 had generated any amount of distribution. So DPI, just for those who are not initiated, basically means distributions. Like, so in our industry, there's kind of two things. One is book value, and you know that's TVPI. It's kind of like you know,
like how much have the assets you invested in
grown or shrunk
in size.
Versus the capital that's been invested. But DPI is distributions. That's what you can eat, right?
Yeah,
you know, that's money
real.
going back into your account. And so, you know, a lot of people are flaunting TVPI, but very few can flaunt DPI. So this is important because this means that limited partners are still not recouping their funds. Another highlight: smaller funds have grown more common. This to me was some great analysis to sort of see how the landscape is changing. They have a really cool chart, and it shows that, you know, in 2024, the majority of any cohort, the majority of funds, 42% of funds were $1 million to $10 million funds. And then if you combine that with funds that were $10 million to $25 million, it's just shy of 70% of the funds. So, I mean, that's not what this industry used to be
from 10 years ago.
So lots of little funds out there, you know, and if it's a $1 to $10 million fund, it's a single GP. You know, that's what I'm managing right now. And then you might be able to eke out a 2 GP fund at 25. You know, 25 is probably the line where you're a 2 GP fund. And then, you know, when you get above that, then you can start to add more partners, right? So that means the vast majority of funds out there have a single partner or solo GP funds.
More than half or have to be single partner.
It's not and look, I mean, I think that there's a couple of great things about that, right? Like one, smaller funds, you know, much more focused, have to be much more disciplined.
In general, they perform better.
Because they're not just, you know, throwing money out there everywhere, right? They're limited funds. You have to really think about your portfolio construction, how you're going to allocate your checks, what you're going to do from a pro rata for your, you know, follow-on investing. So, and also this probably means that there are many more funds in the market, which means there are many more emerging managers, which means we are seeing diversification of the venture capital industry. So this likely is a very, very good thing, right? It also means that there are probably new LPs into the game. You know, with all these new funds, we're probably seeing a diversification of LPs. So I think there's a lot of good here. It's just an interesting thing to sort of see, you know, over the course from 2020 to 2024. You can see that combination. In 2020, for those who are not watching, 25% of the funds were 1 to 10 million, and 24% of the funds were in the 10 to 25 million. So we've basically gone from 50% to 70% over the course of the last 5 years. That's a pretty big shift.
Yeah, it used to be that 25 to 100 range was sort of where most of the early stage funds
lived.
And now it's definitely shifted smaller and fewer GPs.
And then, you know, they say that the TVPI, you know, that total value number that's not actually distributed, slight positive momentum, which is good. So, you know, kind of steady as she goes for the overall VC industry. Rock Health put out their first half 2025 market overview, and I think to me the highlight here, not so much sort of the deal count, but the fact that M&A has picked back up in the digital health space. So we are kind of on track to double last year's number of M&A deals, and I think that's really important. That's really, really good to see.
Yeah, we need to have a process where good companies can be sold for a fair price,
right?
Just because otherwise the whole system gets kind of gummed up, and you can't return money to investors, and then they can't invest in new funds and start the whole process.
Yeah. So we still are, not booming on the IPO side, but the M&A side is quite frankly where most of us, get to our distributions, and it's if you can 2x year over year the number of M&A, transactions that are happening, I'm all for that. Yeah. That's great news, right? Great news. All right, and then talking about things that we didn't quite expect, because who's going to be talking about this when you're talking about, all the brutal cuts to Medicaid?
Yeah, I didn't even know this topic was part of the bill at all.
Well, this is what happens when you have a 900-page bill. Right. Like there's a million things in there you don't even know about. But and I do think that this, it's hard to celebrate something like this against the backdrop of what has happened with Medicaid and the ICE stuff and things like that. So it's difficult. But in our industry, I think we have to report on it, right? So in the VC,
this is a big change.
Yeah. In the VC industry, when you think about why an investor would invest in venture capital, which is very illiquid, right? You put your money in a venture capital fund, you don't get it out until the distributions come out. You can't pull it, you can't call it, you have no access to it, right? And so why would you do that? So the primary top line reason you would do it is because the venture capital industry promises, superior returns. And there was certainly a period of time where that was true. Because of the performance of the stock market over the last 5 years, like it's getting harder to beat. Yeah. It's getting harder on average for VCs to beat the market, right? So you really have to be in that 3.5x and up MOIC to like generate an internal rate of return.
To be worth tying it up.
To be worth the tying up in the illiquid front, right? But like one of the hacks, and this is specifically true for early stage venture, right? One of the hacks that adds another reason why investors would come in is there are some tax benefits that come along with investing in venture firms that are investing in small businesses, small C corporations, right? And that standard is called QSBS, Qualified Small Business Stock. And so you really wouldn't know this unless you're in the venture industry. Right. This is not something you would know. But basically, if you invest in a small business C corporation, and you hold that stock for 5 years, once the company sells and you get your proceeds up to a certain amount, you don't pay taxes.
Yeah, no capital gains tax.
No capital gains taxes. Right. So that's
a huge benefit.
That's huge. Okay.
Right.
That's a ridiculous benefit. So that's
been true for 10 years.
Yes, right. yes. QSBS has been a big deal and very positive for the VC industry. So now, like, this is one of the things that everyone was asking, like, with Trump, what's going to happen with QSBS? Because he's been pretty anti the carried interest thing. Right. So you didn't know whether or not this was going to be part of the things he felt should. So actually, this went the other way. So QSBS 2.0, Chris Harvey is a pretty popular emerging fund lawyer. He's got a great Substack, and we've linked here to his LinkedIn newsletter. But he basically lays out QSBS 2.0, which basically has a new tiered holding period. So as I said before, 5 years you'd have to hold in order to have no taxes. Now they've got tiers 3, 4, and 5 years, and if you sell in 3 years, 50% tax free, right? 50% of the proceeds are tax free. 4 years, 75%, I think, and then 5 years, 100%. So that actually incentivizes you to offload something earlier because you might pay some more taxes, but your IRR is higher because you're getting the capital back quicker, right? So that's a plus if you're in our industry. Per taxpayer cap. So before, the max amount that you could get in proceeds that would be tax-free before you start paying capital gains tax was 10 million. Now it's 15 million.
Yeah.
And then the size of the company. So this would, generally speaking, I mean, Vic's got a more technical definition for this, but the pre-money valuation, what the company's worth when you invest in it.
Yeah.
Before, it was 50 million. For context, Vic and I basically never invest in companies that are worth more than
25 years. I haven't done. I mean, I've done follow-on rounds above 50, but I've never done an original round.
Right.
Even close to 50.
So now they've bumped up to 75 million.
Right.
So now, I mean, basically, you can invest in a firm that does Series B investing.
Yeah.
And I think you would be in the pocket now. 75 million? I mean,
Yeah.
that's Series B territory, right?
Yeah. Yeah. So I think it's all positive in the sense it's going to encourage investment in early stage, high growth companies.
High growth companies, yes.
And you can, obviously, like we're talking about it, you can do it through a fund. You can be an LP and it gets, we pass it through on the K1 to you, so you don't have to worry about it. Or you can be an angel investor and invest directly, and you got to file the paperwork and everything correctly. But it's across the board, and it'll encourage more investment in early stage things, which is great. Good for the VC industry, good for our investors, good overall. I think it is often true that we will hold it for 5 years, but I love the optionality that if you can sell something in 3, it might be worth it. You can choose. You can decide not to sell. You still wait 5 years and get the 100%. There's nothing about these changes that isn't 100% positive, I think.
Yeah, and to me, Chris Harvey in this letter, he thanks the Carta policy team. He kind of credits them with really working.
Yeah.
And to me, this is just sort of one of those symbols of the partnership that is big tech and the GOP, right? You know what I mean? This is, just you can see that big tech has found a way to actually, and sorry, I don't mean big tech. I mean, the VC world has found a way to actually effectively lobby now. So it's
good. I mean, it's good for the upper side of the K.
Yeah. Now let's talk about the lower side of the K.
Right.
Okay. So I think it is helpful when the Wall Street Journal writes an article breaking down the healthcare cuts, right? Because
they're not super liberal, worried about that. I think they're mostly conservative slanted, if anything.
The Wall Street Journal is unquestionably on the right. Now, it is not as far right as many on the right would like it to be, but it's unquestionably center right.
Right.
It's just not. It's not center left. It's center right. Okay. So I think this is a good article.
Yeah.
To start with, as we're talking about what this big beautiful bill is doing to healthcare in America. Okay. So I'm just going to read the headlines, right? So how healthcare cuts in the big beautiful bill will affect Americans. Millions will lose coverage. Hospitals' uncompensated work will increase, and insurers will lose big business. Those are the 3 big points that they are trying to communicate here. Millions will lose coverage. Hospitals' uncompensated work will increase, and insurers will lose big business. So to me, that sounds like many citizens lose access to care, and the healthcare industry, both sides, provider and payer, are going to be impaired.
Yeah, that's right. And it's all largely the same through Medicaid. That's where most of the millions of people are going to lose coverage.
Yes.
And that then drives uncompensated care, and it knocks people off the insured rolls.
Yeah.
It's all intertwined.
Socioeconomically speaking, the least of us.
Yes. By definition, Medicaid is for the poor and children.
Yes. So,
but then it's not equal state by state.
Well, that's because every state has its own relationship with
Medicaid.
With Medicaid, right. So,
but that's an important thing to talk through. That's why I like this article as well, because it's not the same in Tennessee as it is in Oregon.
Yeah. So it was good to see the Wall Street Journal working with Manat Health because I've told you I think they do the best sort of regular coverage on Medicaid and Medicare out there. So it's great to see them pulling their analysis in. And, what they do a great job of highlighting is that the states that were non-Medicaid expansion states are generally on the lower end of the spectrum in terms of change of enrollment. I was actually a little bit shocked to see Louisiana was not in that cohort, that they are actually, in fact, a Medicaid expansion state, and they are going to be most impaired in terms of change of enrollment. So the spectrum kind of goes from -5% change in enrollment and a little bit lower to 15%, negative change in enrollment and up. On balance, across the United States, 10% change of enrollment over the next 10 years.
Yeah. Right. So it's going to affect every state.
Yes.
But there are some states that are going to be more affected. More people in this graphic, more people is what it's referring to. More people in Oregon, Nevada, and Louisiana, and Connecticut, I think.
Yeah.
15 to 18% of the enrollment is going to lose coverage.
Yeah. Hospitals will lose funds. So there's a map that is laying out in the same way the projected reductions in Medicaid payments to hospitals over the course of the next 10 years. And those change in payments go from -8% to -24%, with the blended number across the United States being -18% change in Medicaid payments. Obviously, depending on your payer mix, this is more or less impactful. So safety net hospitals, incredibly impactful. Rural hospitals, incredibly impactful. Nonprofit hospitals, pretty impactful.
Yeah.
I would say significantly impactful. And so this is going to be brutal. It's going to be absolutely brutal. Many, many, many hospitals will just simply not be able to operate. Now, Murkowski was able to fight to get that sort of rural hospital support addendum added in.
Yeah.
That's going to kind of offset this for some period of time, but that's not a long-term fix. And I worry about how that gets allocated and things of that nature. So, she tried from her position to do what she could. And at the same time, she voted for the bill, right? So that was probably the negotiation she had to do. She was like, they were probably like, if you want us to agree to this offset, you have to vote for the bill.
Yeah.
She looked to be incredibly conflicted and kind of disgusted with herself in the interviews afterwards. And so it's a dirty game.
Yeah. I mean, I think that there's a lot of health systems that don't have the profit margins to take this cut.
Yeah.
And so I don't know what's going to happen, but it's going to be really difficult in safety net in rural hospitals.
Yeah, and I think I'm going to just get out in front of it because we're going to continue to talk about this. We're largely going to talk about this from an industry perspective. I think we are nowhere close to exhausting the analysis and the commentary on this bill, right? It's such a dramatic bill. There are a variety of different analyses out there that are talking about how many people will die as a result of this, about how many towns will shutter because the hospital that's the main employer will no longer be there. We will, over time, as we get a chance to sort of digest and make sure we understand and can verify the sources, we will bring those into our analysis on a week over week basis. But right now, don't want to think that we're not going to talk about the human impact. Just right now, it's much clearer to talk in terms of the payments and the enrollment. That's a much clearer sort of first order impact.
Yeah, that's right.
Yeah. Okay. And then And then enrollments. So we've talked about the enrollees and how across the country over the next 10 years is 10% haircut. Then we just talked about 18% haircut on the Medicaid payments. And now talking about the number of enrollees. And so you don't have to do another negative because we've already covered that 10% of the enrollees across the country. Centene is leading the pack. With 12.96 million Medicaid insured enrollees. But Elevance, 8.86 million. United Healthcare, 7.57 million. Molina, 4.8 million. CVS Aetna, 2.4 million. And so if you just take a 10%.
Yeah, they're all going to lose lives.
Yeah, they're all going to lose lives. But I mean, in the case of Centene, 1.3 million lives. I mean, that's a lot of people.
It's a lot of people, and it's going to be,
a lot of people, a lot of revenue,
Right. A lot of, yes.
And you have to think that based on us looking at the different states and knowing that in those states where there was significant expansion, that the decrease will be more significant there, it could create significant P&L pressure in some of those states where the drop is like, 15, 20% decrease, right?
Yeah.
And do they even stay in that market? If you lose that many people on the rolls, can you stay in that market? It's just a question.
Yeah. I mean, I don't know. I think there will be markets that some of these payers leave, almost certainly. I think it also is true that the states themselves are going to be under significant budget pressure.
Yes.
Which we haven't talked about yet, but that's going to then affect all the public services and everything the state does.
Absolutely.
For its people.
Yeah. I mean, I've talked to you about what's happening in New York with because New York news was, this was coming, plus also all the blue states are getting hit directly in other, sort of punitive ways. And they've already proactively, talked about cutting the not just talked about, but I mean, they're going to, I think by next year, cut the Medicaid ABA rates by 45%.
Yeah.
I mean, you might as well just end ABA for Medicaid in New York State.
The providers are not going to be able to do it. They can't
Who can
live.
do that?
Right.
Who can take a 45% haircut?
Right.
So, there's going to be so many implications for this. I mean, I think that's why, in one way, I'm very glad I didn't do a show last week because there would have been no way to address the gravity with the sobriety necessary to respect the future impact to this country. I mean, this is so significant.
Trump signed into law. It's law now. We don't know all the things that are going to roll out because there's a lot to it. But we're not going back for a year to 4 years at the least.
No. All right. So Nick Hutt at HFMA highlights a couple of additional things, even beyond the enrollment and the payments changes. There are other things that are targeting hospitals. So executive compensation. And I think, the way that I sort of looked at this is really focused on not-for-profit hospitals. We've had a lot of conversations with Emily about the mulling amongst this administration and this cohort of the GOP across the Senate and House around really questioning the fundamental validity of nonprofit hospitals, right? Like, based on the amount of money that they make, should they be treated as nonprofit entities? And you can see this is starting to kind of chip away at that a little bit. They're now going to tax, they're expanding a 21% excise tax on executive compensation that exceeds $1 million. And so far, that tax is only applied to the 5 highest compensated employees in an organization in any given year, plus anyone who's been on the list from a prior year. But now, for these institutions that cannot pay stock incentives or anything like that, if you're in that $1 million club, the hospital is now going to have to pay an additional tax on top of that. So that's a bigger hit to the P&L, probably is going to impair keeping people below that $1 million line, which the byproduct of that is it's less attractive to work in this. It's less attractive to work in this far more difficult environment, right? What's the upside for you to do it?
I mean, they're going to chase talent away.
Yeah. I mean, they're doing everything to push talent away, right? And so that is...
so they've already had the excise tax, but it was only for the top 5 highest earners.
Right.
And now they have removed that. It's just everyone that makes over $1 million.
Right. So that's a significant de-incentivizing tactic. To sort of, it feels to me like they just want to push these nonprofits to become for-profit. You know, that's what, when I see something like this, I'm like, dude, I mean, they already have the worst, a much harder payer mix than the for-profits, right? So they're going to be impacted in an outsized way, for everything we just spent the last 10 minutes talking about. Now, and now you're doing like little nitpicky things just to kind of like chip away at their viability. It just feels, but only for the not-for-profits, right? If for-profit, you can pay anybody anything you want.
Well, a for-profit would have to pay taxes too. Yeah, but they are used to that.
Yes,
and they don't have the same. I mean, you can get stock options, so you might be very happy with an $800K salary and then stock options. Where if you're in a non-for-profit, that entire incentive comp package
doesn't exist.
Doesn't exist.
Yeah.
Yeah. I mean, I agree that it's going to be really painful for the nonprofits. I don't agree they'll turn to for-profit because I don't think the markets are going to support it.
No, I'm not saying that. I'm saying it feels like they're, what Emily has been saying, sort of, I'm reading into this and I'm saying, it feels like they're trying to push them to do that.
Yeah.
I'm not saying they're going to do it, but it's going to be very difficult for them.
Yes.
Really difficult for them.
Yeah. I just don't think that some of the markets where nonprofits are really serving an important role won't sustain a for-profit business. So.
Yeah. They're going to put a tax on things like employee parking and transportation fringe benefits.
Right.
It's just like, it just seems.
I mean, I get it. And I also think it's like too overly like picky. I mean, like let them have the parking benefit. I mean, who cares?
Yeah. And then finally, and this is not for hospitals specifically, but this is a focus for academic medical centers. A new tax on endowments that starts in 2026, maxing out at 8% for adjusted endowments of $2 million or more per student. So, now the endowments are also under fire, right?
Yeah. There's not much support today, and this bill's taking a lot of support away from health systems and from Medicaid enrollees.
But more tax cuts for the VCs.
Yeah, we get a tax cut, and the estate tax is going to be maintained at $15 million exemption per person. So it's good for the wealthy people, but it's good for VCs. Which we are VCs, so I guess it's fine, but not good for poor people.
I want to live in a functional society.
Right.
You know what I mean? Like,
yes,
I'm happy to pay taxes, and you know what I mean? Like, it's breathtaking. It's just amazing. It's amazing that this is the bill that passed.
Well, I mean, I think that
this is where it landed.
I think this is what Trump ran on, and he's like twisted arms to deliver it. It is going to have long-lasting repercussions.
I think I'm not sure he ran on cutting Medicaid and simultaneously increasing the deficit. I'm not sure that was the platform.
Yeah, but I don't think he could get. I don't think he could get his tax, cuts from 2017 renewed, and no tax on tips and all the other things he had promised without trying to negotiate with other people around various pet projects that they wanted. So.
All right, more to discuss there, but just a
yeah, we're going to talk about that until the midterms. We're going to talk about that.
yes, agreed. Okay, Andreessen Horowitz, we're leaving Delaware, and we think you should consider leaving too. So we've put this in policy. This is not in the VC section. We've been talking a lot about the buildup of the stock market and the corporate business in Texas. Mm-hmm. Elon's really sort of been driving that, and Andreessen Horowitz is sort of getting in on the whole bashing Delaware bit here, mm-hmm. talking about moving to Nevada. And they, what they say here is that they're moving the state of incorporation of their primary business. So they're not saying we're changing every company in our portfolio mm-hmm. to be there. But they are signaling that they probably will be making investments and sort of suggesting that companies shift their incorporation from Delaware to Nevada.
Yeah, that's right. And I mean, I think there are reasons to be frustrated with the Delaware court system. And also it's bringing a lot of more complexity to this legal process that is maybe not the main thrust, especially in the early stages. But yeah, they're leaving Delaware and going to Nevada. And I think there'll be lots of people that stay in Delaware, lots of people that go to Texas. We have assets in Tennessee and Delaware. It's going to be like a free for all kinds of states
mm-hmm.
and things.
Mm-hmm. They give this long thing about how Delaware, used to be non-ideological and now has gotten involved in politics and is, getting persnickety and things like that. Fine. They talk about shareholder limits on director and officer exposure, mm-hmm. statutory business judgment rule. I think that this, inspection of corporate books and records. Look, Nevada's in the West, right? I mean, it's just going to be more laissez-faire than an East Coast, approach will be. I think, and they're also talking about the established business courts and how Delaware has the Court of Chancery and used to be trustworthy, but now Nevada is establishing a business court. Texas has a business court, so there's other places that they don't have a monopoly on that business. I experience this as increased legal fees for us and what we do. Right, what makes our industry highly efficient is when we look at a deal. We're not doing the deal unless the company is a Delaware C Corp because we know what that is and we know what the rules are.
Right,
and
don't have to think about it.
You don't have to think about it. It's just like we all know what that is. If we have to start thinking about companies that we invest in being incorporated in 2 or 3 different jurisdictions, it's just going to make the lawyers rich. That's my, I don't think about that many things go into, for us early stage investors, that many things go into, corporate court. And I just don't.
Yeah.
That's not something I'm worried about.
I mean, in 25 years, I've never had a case go to trial like that.
Right. But you pay plenty of lawyers to read through contracts and make sure we're together. So I just see this as like increased legal fees and not very fun.
Yes.
Yeah, not exciting. So fine. Thanks, Andreessen Horowitz. Okay. Moving into the payer world, more pressure mounts on health insurers as costs continue to rise. We just talked about what the impact is going to be to all the different payers. We listed Molina there as they have a pretty heavy government pay business. And Molina has warned Wall Street that they will not meet expectations. And they are not the first to say that.
Right. Yeah, that's right. There's going to be several quarters with payers and health systems warning or missing earnings. Or there's not. I mean, Blue Cross is out there, but there aren't as many nonprofit, just by numbers, payers. So the health systems has that whole nonprofit thing that aren't in the public stock market that will be slower, sort of getting numbers out. But yeah, Molina's suffering.
HCSC launches a rebrand of its Medicare unit as HealthSpring.
Which is what it already was.
What's old is new again.
That's right.
So I mean, HCSC, they bought the Medicare business from Cigna, and Cigna's Medicare business was called HealthSpring.
Yeah, they bought Nashville-based HealthSpring.
Yes,
to make it
right.
I like the brand HealthSpring.
Yeah, but it's a Nashville brand.
Exactly. But I don't know that. I don't know. I guess it's fine. I mean, it's a well-known brand in Medicare Advantage. So.
Yeah, it's just a silly headline. I'm glad you included it because it just shows how
They added a little swoopy icon.
Yeah. What did they say? It represents the vibrancy and vitality of the brand.
Yeah. Some consultant got paid a lot to do that.
When are we going to get that gig?
Yeah.
To change the color of a logo slightly. You get paid like $2 million to do it. CVS Omnicare ordered to pay $949 million in government fraud case, almost $1 billion. So Omnicare is CVS's pharmacy business that is non-retail. So the one that works with, different providers around the country. And, Manhattan Judge Colleen McMahon imposed a $542 million penalty for what she called very big fraud in her Monday order, and awarded $406.8 million in damages, 3 times the $135.6 million that a jury awarded in the spring as required under the False Claims Act. So, I mean, CVS Omnicare filed more than 3.3 million false claims between 2010 and 2018, according to court documents. 3.3 million false claims?
Yeah. I mean,
that's crazy.
This is a crazy story. I mean,
it's crazy.
So Omnicare has been found guilty of sending prescription medications to assisted living facilities or nursing homes, other institutions. This is not a retail platform.
Right.
When they didn't have prescriptions for them, they just were sending them over and charging. It's hard to believe that over 3 million false claims over 8 years happened, but that is what the court found, and so almost $1 billion in fees, a huge penalty, and a very big fraud. So huge. I mean, $1 billion.
Yeah. So that's
CVS is in trouble, and this is not even their upcoding.
No, it's not the upcoding.
It's not the upcoding case.
When I saw the headline, I was like, "Is this the upcoding case?" And it's like, no. It's like, oh my god, they've got a lot of fraud. That they're dealing with.
I didn't put it in, but United Health Group is being investigated all over the place. There was no point to the story. Just like, they're being investigated. So, there's a lot of investigations into the payers.
Oof. Samsung to acquire digital health firm Xealth. I think that's how you pronounce it.
Yeah, I think that's right.
So, Samsung's been teasing about getting involved in health for a very, very, very long time. But this is a pretty meaningful acquisition. So for anyone who doesn't know, Xealth, which is spelled Xealth, so health, except for replace the H with an X. It's like the digital health app store inside of the EMR at hospitals, right? So, a clinician from inside of their Epic instance can open up Xealth and they can
know
access,
it's going to work.
They know it's going to work. It's all certified. It's all approved. And they can access Weight Watchers, or maybe there's like a Fitbit integration or something like that. Yeah. So they can pull in all these digital health, but like not little guy digital health things. They're like real big digital health things. And they can integrate them into their prescriptions, the protocols that they're,
they can tell a patients on. I'd like you to exercise more.
Right.
Here are the 4 apps that we offer.
That's right.
And the patient, and it will tie back to the EMR.
Right.
So I think I would love for Samsung to get in like seriously into healthcare. They've been, as you say, they've been sort of talking about it. So it's great to see them make this acquisition, and hopefully they'll grow. Yeah,
I mean, they've got their Galaxy watches. Apple has had a partnership with Epic and has used that to proliferate through many, many hospitals. I first learned about that, I think, in 2017 when our friend Steve Tremitier, brought me up to Geisinger, and I was like, oh wow, here's Apple and Epic working at Geisinger, and just like everyone's got iPhones everywhere. So this, to me, especially when we have RFK Jr. talking about how he wants everyone to have a wearable on, seems pretty smart for Samsung to start to get meaningfully integrated into the health systems.
Yeah,
right?
I agree.
Okay. Symplr acquires AMN Healthcare's staff scheduling software for $75 million. So, we like Symplr. They bought stuff from us before. Right. So, and this is we like M&A deals.
Yeah, and scheduling is a big problem. I mean, we've made a couple of investments trying to solve it. Health systems are still doing scheduling on paper or in complicated Excel sheets. And so I think Symplr will be able to take AMN's scheduling software and, it's hard when you're the vendor bringing kind of travel nurses in to be trusted to schedule the whole thing.
Right.
I think Symplr is a better place to bring that from.
Yeah, so. And it looks like there's also some additional strategic synergies that Symplr and AMN are putting together here between the operational technology and the workforce solutions on both sides. So, it looks like a good partnership there. Okay, going into pharma, Merck is buying Verona Pharma in a $10 billion deal. So Verona Pharma is a publicly traded company on the London Stock Exchange, and $10 billion seems like a pretty good deal.
Yeah. It's a COPD treatment. So it's a 20% premium on what it's been trading, a little over.
It's great for the shareholders.
Yeah, and it gets Merck into the COPD space. Seems good all around.
Yeah. So we're used to talking about $1 billion transactions.
Right. Yeah,
that's a big deal. Okay, so Health and Us. This story is terrifying.
Yeah, this is a rough story.
Wall Street Journal. Here's the headline. She paid $1 million to join a senior facility. Its bankruptcy wiped her out. I mean, this is the kind of thing you don't really think about, but you really should. And so this story is covering this woman. Her name is Arlene Cohen, and she was a widow, and she moved into Harborside, which is a continuing care retirement community. So kind of has the whole step up or step down, depending on how you like to see it.
Right.
But that whole continuum of care starts with, independent living, then moves to assisted living, then moves into,
And there's a buy-in. There's always a buy-in in those.
So the buy-in was $945,000. Okay. Mm-hmm. And then on top of that, you pay $5,700 in monthly fees. And then what they said was that 75% of that upfront fee would be refundable to her family upon her death. Okay, that's what they told her. Except they went bankrupt.
Right.
And now their family thinks they're going to get less than a third of the $710,000 refund that was promised to them. And now she's got to be in a new facility.
Right.
She
doesn't have money to do the buy-in for the next facility. She can't do the buy-in
for the next facility. So she's just in just a new facility, right? She's at Sunrise Senior Living now, but she sold her house to buy in to this Harborside place, and they robbed her.
Yeah,
they robbed her.
I think more incompetence, but yes, the result's the same. They wasted and lost the money.
Yeah.
And she's the one that interviewed with the Wall Street Journal. I think there's probably a lot of seniors at that facility that when they went bankrupt, you lost your buy-in. Everyone lost their buy-in.
And that just tells you how unregulated these places are, because anytime you take an entrance fee like that and then you say we will repay 75% of that fee, that's kind of like a bank. You ought to be regulated. Someone ought to be able to check that you've got that money sitting in escrow somewhere where you can't get to it. And it should be earning interest or whatever.
It should be like an insurance regulation.
Yeah.
You have to reserve capital to actually deliver on the care you have promised.
That is shocking that this can even happen.
Yeah. They're not regulated
these
like
dollar
that.
amounts?
Yeah. Yeah.
For people who cannot be economically productive ever again?
Yeah,
that's shocking, Vic.
It's shocking and it's sad. And I don't know that we have regulators that can take it on, but you're right. There's no way for the individual family to decide, okay, this place is well run, this other place is not. Yeah, it's a sad story, but it's a kind of a warning. You need to somehow try to look into their policies or something. I don't know. Like if I was going to do it right now with one of my parents, I don't know how I would assess it.
I mean, so here's the really tricky thing, right? The tricky thing is that how this generally works is most of these people, they have Medicare and they have some savings, but the real long-term care money is in their house. It's in their home equity. And so that means in order to unlock it, you have to leave it. You have to leave it and you have to sell the house, right? So the whole idea of we'll just do the care at home, you really can't do that.
Yeah, because you need the money out of the house.
You need the money out of the house. You have to sell the house to unlock the cash to then do whatever the thing is that you're going to do. So then it's like, okay, well then where, maybe you look for a much smaller place where, okay, you take those proceeds, you buy something much, much smaller, and then you take the remaining cash.
Oh, if you're going to do it yourself,
if you're going to do it yourself. Yeah, sorry, I wasn't that clear. Yeah, if you're going to do it yourself. But the truth is there's just not that many options on how to do this.
Yeah, and it's hard to know how long the senior will be independent. I mean, we're all aging. So
almost impossible.
There will be a time when they can't live alone anymore.
Yes.
And so I think that's why these whatever they're called, continuation facilities make sense, because you move into the independent living and you might be there for 6 months or 6 years or 12 years. But whenever you have to move to assisted living and then memory care, it's there for you.
Right.
The problem is there's a lot of planning involved in that. And it's really difficult for these facilities to know who's going to move when, how do I organize this? And I think the truth is they just don't plan very well.
Right.
They just close their eyes and hope.
Terrible, scary story.
Yeah.
And definitely, I mean, I'm kind of living this right now. And so like it gives me something to think about and to look out for.
Yeah. And I don't know how you look out for yourself. I mean, like, I don't know what I would try to do due diligence on.
Right.
Like,
right. Yeah. Robinhood. Oh, so we're in a Web3 section.
Yeah, Web3 section.
Web3 section. Okay, good. Robinhood wants to redo Wall Street on the blockchain. So Robinhood made a huge splash last week by offering tokenized stocks. Robinhood is actually just really crushing it. They had that black eye moment when like they had to shut down the app because all the crazy trading that was happening, and but they really, I didn't realize that they had positioned so aggressively around crypto. But if you
they bought Bitstamp.
Yeah, but here's what I mean when I say positioning. Like if you go to the App Store and you go to download Robinhood, how they list Robinhood in the App Store is Robinhood buy BTC ETH Sol. So they're actually positioned as like a crypto app.
Yeah, that's interesting.
Which is crazy because they came out of the gate as a stock.
Yeah, right.
As a stocks app, right? And how they really differentiate against Coinbase is they're 100% retail focused, right? Whereas Coinbase has a big institutional business now. Yeah. They've got the base network, all these other kind of things.
Yeah.
Robinhood's very, very focused on retail, right? And so they are now tokenizing not the actual stock, because they can't actually tokenize, these private company stocks. But they are tokenizing.
Let's start with the easier thing to start. Publicly traded stocks.
Yes. Sorry, I'm focused on OpenAI.
The place to start, where they started they're in Europe.
Yes.
Live, where you can buy, I don't know, Google, any publicly traded stock through their app, and they are tracking it with a token, and then they they will buy so they do it 24/7 on the weekends, whatever you can buy. And then they will buy a share of Google and kind of match it. So that's where they started. And then they have built their own ETFs where they group together like all the Mag 7 or whatever they decide they want to do and offer lots of optionality. And you don't have to buy a full share.
Right.
You can put $5 in. You can do dollar cost averaging, $5 a day, all that stuff that they created. They're doing. And then they did OpenAI and Starlink. SpaceX.
Which are private companies.
Those are the two they are offering in Europe still.
Yes.
And they have formed a partnership. They didn't announce who it was with someone, a VC firm or a family office that holds some of those shares so that they have the rights to buy them.
Right.
I think that's how it works.
Yeah.
They only are offering those two right now, but they are promising to offer a large number of privately traded assets. And then they are coming to the US.
Which is crazy because that front runs an IPO.
Yeah.
And like any potential future IPO, you're letting the retail market get in to the private markets through this token loophole. I mean,
which they should be in.
No, of course. I'm so excited about this. I think this is great, but it's a big deal.
Yes. It's changing the accreditation rules.
Yes.
Is the effectiveness of it. So they've done it in Europe. It's live.
Right.
And they are now pushing for regulations to bring it to the US, but it's not live here yet.
No.
We have the next articles or a couple articles. The SEC is, I think, open to it, but we'll get to that when we get to it.
Yeah.
So I think it's really exciting that they're
by the way, I
pushing
think we
this.
need to say Robinhood, I think, was one of 3 exchange-based businesses last week that had some type of tokenization announcement. So clearly there's a wave of tokenization that is on the horizon. And the fact that you can do all this in Europe today, it's like people talk about all the crazy regulation of Europe, et cetera, but it's like not on crypto.
Right.
They're way ahead of us on crypto.
Yes.
Way ahead of us on crypto. So just worth pointing out. Worth pointing out. This is an X post where Vlad was talking. And so yes, SEC Chairman Paul Atkins, we've got a link in the show notes to an interview with him on CNBC. But basically he is signaling very early in his chairmanship, he's signaling that he is open to exploring and running pilots with the tokenization of private companies.
Yeah. He basically is saying the SEC should be innovative. We should have the most innovative financial markets. And he wants to move into it slowly, but he thinks his job is to turn the SEC into like an enabling engine.
Yeah.
So it's all really positive to innovation.
Yeah, I continue to see things like this and just be so mad at Elizabeth Warren. You know what I mean? Like,
it's self-inflicted for no benefit.
It's ridiculous.
Yeah,
it's ridiculous. It was so stupid. It was so stupid because it was also inevitable. It was inevitable. Like, it's happening in all manner of continents all over the world.
Yeah, right.
Like, what were you doing? What do you think you're doing? Okay, I talk about this every time we bring this up. It just makes me mad because it did not serve the Democrats in any way.
No, they just seemed out of touch.
Yes, and she's still running her mouth about this shit.
Yes.
You know this. She's still talking about it. It's like, could you please just shut up, or somebody primary her or something? I don't know, man. I mean, but like,
yeah, she doesn't understand it.
No, she's not helpful. Okay, United States. House Committee on Ways and Means. So the Genius Act, which we talked about, I guess in the last show, which would have been 2 weeks ago, passed the Senate, sponsored by Bill Hagerty. It's now in the House. Apparently there's another bill in the House called the Stable Act. And so I think they're kind of figuring out which of these is going to make it through. I think the Genius Act is the one that the whole industry is behind at this point. So I think that's the one that's going to get pushed through. But in the House, they are exploring, I think, a broader set of questions, some that are about the market structure. And that's kind of, this whole tokenization of private assets or public assets, right? Just the idea that we can, basically create a token if we can make a token against the dollar, why can't we make a token against, securities?
I mean, I'll go even further. You can make a meme coin on nothing.
Fart coin. Right.
And I can invest money in
Today.
in quotes, money in that.
Today.
Yeah, today.
Yeah.
And so why can't I buy Google?
It's so stupid. It's really stupid. Yes, that's right. But they are looking at broader things like market structure, but also tax policies. So there's a lot of people pushing for crypto to be a non-capital gains taxable transaction platform.
There's a lot of people pushing for that. I don't think that makes sense, but yes, there are people pushing it.
So
I mean, people will talk about when you're talking about actual currencies. So like Bitcoin and ETH, I can see.
Right.
Solana, maybe I can see.
Right, but the tokenization.
But when you go
to,
me tokenizing a company that I invested in, a little startup, that should be capital gains. Like when I sell it and I make a bunch of money, I think you should pay capital gains from that. I mean, I don't think it makes sense.
I mean, look,
but yes, there's a lot of
this group.
There's a lot of hope.
This group,
there's a lot of rumors
this
that
group,
there's no taxes anywhere.
Right.
No
taxes anywhere, and let the poor eat themselves. I mean, like, who cares? We'll be fine on our jets.
Yeah.
Right. Okay. Moving into AI. So starting with this Reddit post. This is in the subreddit ChatGPT, and a doctor did a really thoughtful post around his assessment of ChatGPT and what it really means to use it in a clinical setting, right? So the title of the post is, "As an MD, here's my 100% honest opinion and observations, advices about using ChatGPT." And basically, he says it's incredible, but also as we've been saying from the beginning about all this LLM stuff, it depends on what you feed it and how you prompt it.
Yeah.
Right. Depends on what you feed it and how you prompt it. So
it's worth reading. We'll put a link in the show. It's worth reading it because he does a really good job laying it out in a organized fashion, but we can summarize it here.
And I think his general recommendation is you should use ChatGPT to second guess your doctor. Mm-hmm. Yes. You should use ChatGPT to prepare for your clinic visits. Yes. But you should not use ChatGPT to validate your fears. And this is kind of the big thing that I think people are starting to realize is that these LLMs, they don't tell the truth. And I don't mean that to say they lie, but I mean that to say that they absolutely will feed your cognitive bias.
Yeah, they are tuned to satisfy you or make you happy with the response.
Yes.
So they literally are optimized to give you an answer that will please you or will make you happy. And so, yeah, if you are, if you have fears, I mean, the example he gives, if you ask enough different ways, if you have cancer, would this mean I have cancer? That by the time you ask the fourth time,
right?
Just like a friend of yours might realize, okay, Marcus, just keep asking me this until I agree. It just says it just starts agreeing with you, and then it will find or make up examples. And the problem is, it's really very good at then building a super compelling case with all kinds of studies, some of which didn't happen, other of which that did happen, but it's framed a little differently. And you get lost in this rabbit hole.
Right, exactly. So anyway, link in the show notes, but thoughtful, right? And always looking for more clinicians to weigh in on this topic because it's the future. It's this integration of clinicians and LLMs. It is absolutely the future. Okay. Boy, this has been a wild ride this week. So Elon Musk has released, and Elon Musk's xAI has released Grok 4. This is the latest model from xAI. And it is, it's a benchmark beater. It's beating many of the other frontier models on a lot of different fronts. The thing that Elon was most talking about was how, his team is using Grok to code and it's much better than Claude. Claude has sort of been the de facto best coding model out there for quite some time now. And so he's pushing that. They've unveiled the $300 per month AI subscription plan for called Super Grok Heavy, because there's a Grok 4 Heavy that's like sort of the really compute and power intensive version of the model. But the problem is this news is happening at the same time as Lindsay Heckerino is resigning as the CEO of X, which happened to also coincide with many people finding Grok to basically speak like a Nazi, and also, speak with a whole bunch of pornographic references specifically to the CEO of X, Lindsay Heckerino. So, this is kind of the problem with Elon is like, he's brilliant, he's very effective, and he's simply not a serious person, which is the weirdest combination of things to say about somebody, right? But he's just not serious. It's like, it's like everything's a joke to this guy, and so his model ends up doing stuff like talking like a Nazi, right? It's just
So I agree. There is, I think, a useful reason to talk about this, which is Elon built the biggest compute so far in Memphis, and the scaling laws are still holding. Right? Like, more compute, more data gives you a smarter model.
Yes.
Period. And I think what that means is that whether Grok is, ends up being a model that a lot of people use or not, I don't know. I think probably not. But I think it means that there's going to be more compute thrown at models because the scaling laws are still holding. So Gemini, OpenAI, Anthropic, Grok, whatever ones I've forgotten, are going to keep throwing more and more compute because it keeps getting smarter. I think you're exactly right that these models need to be controlled and tuned and moderated so they can interact with humans in a productive, healthy way that is empowering. And I'm not sure that Grok is tuned that way, because I haven't even used it, but there's so much noise around it. I think it seems like it's very performative. It beats all the benchmarks, but it also goes off the rails and does all kinds of other stuff.
Yes.
And to me, that means it's not the post-training and all the fine-tuning wasn't done in the way that we're all used to.
Yeah. Well, it's almost certainly tuned to be anti-woke.
Yeah.
Right. So
maybe aside of the fact that is that it talks about Nazis and things. I mean,
well, yeah, because it's not trying to cloak what it means to be anti-woke.
Yeah, it's not socially aware enough to realize that I have to, I don't know, hide it.
Exactly.
Right.
Yes.
Yeah. So I don't think that, I think Grok is late to the party and people already have models they like.
Yeah, and the brand of Grok is not good.
And the brand is not good, but the scaling laws are still working, and we're going to get smarter models.
So we do not have a story about this, I don't think, in our lineup, but your point about the scaling laws and the investments is 100% true across the board. All the Mag 7 have doubled down on their investments all around power and data centers.
Right.
And I was just reading that story earlier today. So for sure, the arms race continues and intensifies.
Yeah.
Because we're just seeing that, the combination of unlimited power, unlimited compute in the form of a data center, and the best brains, human brains, you can put on this is continuing to net better and better and better and better results.
That's right. So OpenAI's 5, I think, will come out this summer or fall. Google's Gemini 3 will be out this fall. So Anthropic, I'm sure, has another. They'll keep coming out, and we're not going to go backwards.
No.
I think other models will be socialized maybe better and fit into society better.
Yes.
But Grok is pretty smart.
Yes. Microsoft is touting $500 million in AI savings while slashing jobs. And so, how they're going to justify making all these massive investments, they're going to keep showing that they can save money by not paying people. Right. So we're going to have more, what's really scary about that is that those Medicaid enrollment numbers could grow over time if we actually end up in the landscape that some people predict that we will be in, where many people, specifically knowledge workers, lose their jobs and simply can't replace them.
Yeah. Well, we don't need as many knowledge workers.
No.
I'm hopeful we will find more
knowledge workers
uses.
Are not very resilient people.
Yeah, that's I have fear about that.
Yes, they're not resilient people, right? They think they are,
right,
but they're not.
Right,
they're not. So talking about the arms race on the hiring side, Meta hires top Apple AI expert, continuing Zuckerberg's recruitment push. This is one of two stories we're going to cover here. But this one I think is pretty meaningful because taking Apple's top hire of AI, that just probably shows a couple things.
Apple's in trouble. I mean,
I was going to say first, Apple's in trouble. And second, Meta is not playing around.
Yeah.
They're offering this guy like $10 million a year.
Right.
So that's crazy, right?
Yeah. Yeah. So Meta took the top AI researcher, and then the COO resigned yesterday from Apple.
Yeah.
So
design is now reporting into Tim Cook.
Yeah. Yeah.
I don't know that that's great.
The last design was not that great. So Apple is struggling. And then I think Meta, to Zuckerberg's credit, they're behind in AI. They tried the open source tactic, which had worked in other technical areas for Meta, but just didn't work, or they didn't pull it off, or they didn't put enough behind it. Llama's not really in the conversation that much anymore.
So it's time to do what he does best. Buy.
Right. Yeah. And to his credit, he put a lot of time and money behind it. Personal time, personally recruiting these people with tons of money.
He might be the best acquirer of this era. He might be the best acquirer. I mean, because like Meta is where it is today because of Instagram.
Yeah. Yeah.
And when he bought Instagram, like everyone thought that was the stupidest billion-dollar acquisition ever.
But it was
and
brilliant.
Look at it now.
Brilliant. Yeah.
Look at it now. Right.
Yeah. Yeah. So this one came out after this story, Zuck's 11. So it's 12 now. But it just lists off he hired 7 senior people from OpenAI.
Right.
2 from Google, 1 from Anthropic, 1 from Sesame. OpenAI, the other thing that's interesting is OpenAI has lost a lot of talent just to Meta. They have a lot of talent, but they're not as deep as Google, and they lost a lot of people.
Yep.
And they're pretty senior folks.
Yeah. So 7 from OpenAI, 2 from Google, 1 from Anthropic, 1 from Sesame, and 1 from Apple.
Yeah.
12.
That's right.
Now. Okay. NVIDIA is now the world's first $4 trillion company.
Yeah. Incredible. I think it's great to see an American company like that's been around for
long time,
40 years.
Yeah.
Keep plodding around, and then they've taken off, but they're working hard, and they have a great product.
Yes.
So
yes.
I think it's good.
It's mind blowing, like to think about how long NVIDIA has been around.
Yeah.
They were just the gaming chip company,
Right. And then all of a sudden, that capability was really valuable in other ways.
Right.
Yeah.
Right. All right. So we got 3 stories here that all sort of make up one thing, which is sort of the shift out of search and into AI chatbots as the primary discovery interface for the internet.
Yeah. Like, what is the front door to the internet?
What is the front door to the internet? And the search engine, which is just a simple one text field form is being replaced by the chatbot, which is also a one text field form. So it was the perfect swap out. Very, very low switching costs.
Yeah.
Right. Higher quality results on the other side, more personalized, and much more interactive. Right. You know, you can go deeper and deeper and deeper
and
with
less
it.
work for the user. Like, just give me what I want.
Yes.
Don't make me go search for all these links.
Right. And put a bunch of advertisements and other crap and blah, 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 blah. Right. So there's now a bunch of, you know, I told you, it's like there's SEO and then there's AIO.
Yeah. Right.
Right. And SEO is dying. It is. And AIO is on the rise.
Yeah.
You know, I'm on the board of, the chair of the Nashville Convention Visitors Corporation. We just launched a brand new website for Visit Music City. And one of the big features of it is that it is AIO'd, meaning it's optimized so that when you search on ChatGPT or Gemini about, hey, help me book a trip to Nashville, this website will be feeding the response that you get from those LLMs, right? Because it's been optimized for that. The same way websites were previously optimized to get, you know, in that first page with the 10 blue links.
Right.
And so it's a whole new discipline in marketing, and therefore there's a whole new set of companies out there and technologies that are helping everyday marketers to make sure that they show up, because the stakes are even higher now, right? It's you know, before it was like, I want to show up on the first page. Now it's, I want to be placed in the first paragraph of the response, right?
Right. Yeah, and for the Visitors Bureau, whatever the group is, they really just want people coming to Nashville and enjoying everything we have to offer, I think.
Yes.
If you are selling a widget or something, the monetization avenue of the internet is a little more complex. So like feeding information is possible with optimizing AI, but getting them to transact and pay you money. So say you're writing a review about, I don't know, new phones. You need to get paid for that somehow. And if you optimize to get your information into the AI without a monetization plan, that's not going to work.
No.
So it's just going to be much more nuanced and complex, I think.
Yeah. At some point it'll become standard, but right now we're all figuring it out
it's all
as
being
we
made up
go.
as we go.
Right?
Yeah. Right.
So we've got this link to this Wall Street Journal story. The headline is, "The company's betting they can profit from Google search's demise," and it just sort of tells you about
about
all the
optimizing
companies
AI,
that are coming out for AIO.
Yeah.
So sort of at the same time, Cloudflare, which is the big DNS caching company that basically is the true front door for the internet that nobody sees. But if you host a big website, it's a pretty good chance that Cloudflare is like serving up and also protecting you from DDoS attacks and things like that.
Yeah, if you want your video to play really fast
quickly,
in Europe, in Australia, in the US, you're using Cloudflare.
Yeah, they're caching that content all around the world.
And then they deal with security for you.
Yes. And so who better to see the impacts of traffic from AI crawlers now that they are everywhere than Cloudflare, right?
Yeah.
They're going to be seeing that, and they recognize that it's their responsibility, just as it has been to protect you from the Russian and South Korean hackers who want to DDoS your site and take it down. They protect you from that. They also want to protect you from these AI bots that have no business crawling your site and taking all your content. And, now you can't monetize your content yourself because the AI has taken it over. Right?
Yeah, it's a threat to their clients, a threat to the Cloudflare business.
Yes. And so they say that they're going to come out and create this, easy button that's going to protect you from the AI bots with one click.
What they are saying is they will allow content producers to charge. So they have a tool that would block the crawlers, and then you can charge for each time it visits your content and grabs it, which would be great. and would probably bring some reasonable economic model. We need people to create content about everything.
Sure.
So that's what they're trying to do.
But the problem is it's
not that easy
to do. And so they're having trouble doing that, but not also shutting down Google search crawlers.
Mm-hmm.
And so you block the AI, but it's also impacting how you show up in SEO. And people don't want that.
Yeah. I think this is this is all interim stuff. Soon, a year from now, I think a lot of content producers will say, I don't care if Google's crawlers come. I care more about being able to stop the AI crawlers.
Well, they'll say, I don't care about Google search, but I do care about Gemini.
Yeah.
Right.
Well, but they're going to want to charge Gemini, whatever it is, some amount in order to get their stuff.
So the problem is Google does not have a separate set of crawlers for Gemini versus Google search.
Right.
It's the same crawler.
Yeah, right.
So if it's the same crawler, it's kind of hard to stop it for one intent and not for another.
Yeah. What I'm saying is I think they're going to eventually just say Google search is over and we're stopping Gemini and Google search.
Yeah, but they got to fix the revenue. They got to fix the revenue first.
Yes.
Right. So this is an entire. I mean, many of the listeners, you may not even know that AIO is even a thing.
Right.
But we just figured this was a fun way to end the show because it's practical, and it's a way that AI is changing the internet, and this is going to actually impact all of us.
Yeah.
Right. Jumpstart has a website.
Yeah.
We're used to doing the SEO thing.
Yeah.
We're not used to doing the AIO thing, and we're going to have to do that now. Thankfully, we work with WordPress and HubSpot.
Yeah.
Those tools they'll take care of this for us. You know what I mean? They'll make sure that everything we have is properly AIO'd.
Yeah. And I think for health systems, maybe for payers, I got to think about that, but getting your
health
site,
systems,
they should be, they're like the Visitors Bureau.
That's right.
They should be educating people about getting their knee and hip done and all the different procedures using AIO, because then you're going to have to show up at the facility and you want to be educating folks about, come to our facility. We have the best recovery rates, the best care, the best doctors.
Yeah.
Whatever you have on your website today, you should customize to AIO.
You know what's really interesting about you saying that? There's probably a window similar to like the dawn of social media where there's big arbitrage upside to leaning in very heavily on this. And this is probably a very big deal for startups.
Yeah.
Right? Where if your audience is heavily indexing to, chatbots over search engines, there's a window. I don't know if it's 12 months, 24 months, 36 months, but there's a window where you really can probably get a huge marketing ROI on deeply investing in AOI.
Yes.
AIO, sorry.
AIO, and then also the influencers in social media plus AI assets.
Yes.
That's a whole nother topic, but you can really leverage thousands of influencers and give them assets that you really couldn't do previously.
Yeah.
And startups, or really anyone can do it, but startups are the ones that are kind of nimble enough and fast enough to be able to do it.
Right. Okay. Good show.
Yeah, it was good.
And next week, I'm sure we'll have more analysis to pour through on the impacts of the bill. And more in the Elon and Trump saga. And also, I mean, we didn't say it at the beginning, but here in Nashville, we've lived through a terrible flood, and it was kind of like trauma-inducing to see what has happened in Texas. Because I remember when the Cumberland River, sort of rose, and it didn't raise anything nearly that fast.
Right.
So it's
right. And my kids went to camp. Wendy knows people that had girls at that camp.
Yeah.
This year, it's really sad to see young children. I mean, anyone getting that, but the children is hard.
It's terrifying how fast the water rose. 90 minutes.
Yeah. In the middle of the night.
Just, really, really scary stuff. So anyway, I pray that we get a handle on this climate stuff.
Yeah.
You know. So, all right. Until next week.